name is Lucy. We're gonna be performing a head and neck assessment. And we're gonna start from the beginning. We're gonna perform hand hygiene. We're gonna introduce to the patient. Say hello, Crystal.
How you doing?
Very good. Can you, my name is Lucy. I'm the nurse practitioner student. We're gonna be performing today your head and neck assessment. Is that okay with you?
Yeah.
Good. So we can see Crystal sitting upright with any discomfort or any acute finding at this moment. During the assessment, we're gonna look for any asymmetry, lesion, masses, scar, dislocation. Also, we're gonna search for any facial, any facial hair distribution, and also we're gonna be looking for any abnormality. So, Crystal, gonna put so as typically we can see that Crystal face is a symmetry. I don't see anything with the skin, nose, and everything. So, Crystal, I'm gonna put my hands in your hair. Is that okay?
Mm-hmm.
We gotta check for any asymmetry, like lump or mass. Can you put your head, remove your headband so I can check better? Also, we can ask the patient for any thinning her hair lately or losing the hair, which you have a lot. You can put it back if you want. Crystal head assessment. It was normal cephalic with no indicator of any trauma. The skin is intact. No lesion, masses, dislocation, or facial hair distribution. Next, we are going to inspect the neck. We're gonna take a look to the front. We're gonna look for any asymmetry or any enlargement, the carotid, or any lymph node that we can see naked eye. We can see the crystals look symmetrical. After we observe the neck, we make sure that no any visual lymph node or any enlargement of we're gonna palpate the area for lymph node. So we're gonna do it with the 2 fingers, okay? We're gonna start from the frontal, and then we go to the posterior. And we're gonna go all the way down. Here. Okay. Then we're gonna, while we're here, we can check for the temporal mandibular, which we call TMJ. We're gonna put it to the back. We go to the attachment area. Can you open your mouth? Okay, perfect. Close. Open one more. So we're looking for any tenderness, soreness, also for any clicking. Okay. Also, when we check for the TMJ, we want to see if when the patient open the mouth, if it's aligned, if it's aligned or with any deviation. Can you open your mouth for me again? Bigger, perfect. Which is increased, so we can see when she open her mouth, and we can feel it here. It's symmetrical. We don't see any deviation. Check for the TMJ. Now we're gonna go to check the thyroid, which is, Crystal, gonna put your head up a little bit. A little bit down, into this. Good. Good. Go to the side. Good. Good. And while we are here checking the thyroid, also we can check for the trachea, not too much. And what we want for the trachea is to make sure that it's aligned, there's no deviation. For the thyroid, I'm gonna ask Crystal to take a sip of water. Can you take a sip of water? When you drink, I need to see your neck. So in my observation, when you take a sip of water, we can see how the thyroid gland and the thyroid caligars, the thyroid cartilagus, and the thyroid gland, they goes rise up. Now I'm gonna touch them to this here. Can you take another sip of water? and I would take my hands here. Okay. Put your head a little bit more and swallow. Okay, which is a normal movement. So now for the final palpation for the thyroid gland, I'm gonna check the sternocleidomastoid area. So it's gonna be, look at me a little bit hard. Put it a bit down. Okay, good. So pretend that you're swallowing. Okay, good. Oh. Well, for the camera, when we are looking for the sternocleidomastoid area, so we're gonna press here in this area. We're gonna ask for the patient to swallow. You can swallow for me. Okay, good. Awesome. During the thyroid assessment for on Crystal, so I did not notice any enlargement, any tenderness. It rise when she was swallowing the water, and also when I checked for the sternomastoid area, so it was right here. That was within the normal finding. No nodules or tenderness, and the thyroid rise is symmetric. Now we're gonna check for range of motion of this cervical area. We're gonna do the assessment for the cervical, which is gonna be looking for any deformity. We're gonna palpate the sternomonostomastoid and trapezius muscles, which is the trapezoid is here, and the trapezius we're gonna find it like this area here. We are looking for any mass, fluorescent span, make sure there is a midline, any deformity, or any tenderness. So now, Crystal, I'm gonna ask you to do a couple of things for me. Can you put your face up, down? Can you touch your shoulder with your ear? Like this. Look at me. Like this. Perfect. Can you touch the other side? Awesome. Can you touch your with your chin, your chest? Awesome. Great. So I will touch the we call it what is the muscle, Jesus Christ? I'm gonna touch this area here, which is the sternocleidomastoid, and also we're gonna check the trapezius. If you feel any pain or discomfort, just let me know. Okay? Let me see. Okay. Okay. Can you swallow for me? Like pretend that you're swallowing something? Swallow? Okay, good. So can you put your head to the side? Okay. Let's get here. Okay, good. Good. Okay, good. Awesome. Thank you. The Crystal cervical assessment. I didn't find any cervical tenderness or deformity, no muscle spasm. Her range of motion is within the normal range. No matter sternomonostomastoid and trapezius muscles, they are visible, and they are not. They don't show any sign of deformity at this time or any acute findings at this moment. This is my second video, so I know this is an opportunity that you're giving me to present the video again. I think I did a little bit better in terms of what I was checking the thyroid and the TMJ, which is, I do admit I didn't went that deep in my first video, but I'm gonna go over Crystal assessment this time, which is the head and neck. So on Crystal, the normal she have a normal cephalic and no atraumatic head. The skin was intact, no lesion masses or discoloration, and no facial hair or distribution of the hair was symmetric, normal. Also, her range of motion for the TMJ, it was with the normal dermal finding, no tenderness or clicking or crepitus. For the thyroid, which is we give it the water to Crystal and she will her thyroid gland, the thyroid colligates, the three of them, they went up simultaneously and returned to the normal position, and no tenderness or nodule. Also, when I check her, also her lymph node around the neck, there was no nodules, no new finding, no swelling. Was without it was fine. So for the cervical assessment, her range of motion was within the range. There's no deformities, no tenderness, no masses, and full range of motions. No discomfort or any pain was reported during the assessment.